This is a critical message for anyone over 60, living in the United States, Canada, United Kingdom, or Australia, who's been struggling with muscle weakness or joint pain. If you've felt your grip getting weaker, your knees aching more often, or noticed that everyday tasks take more energy than they used to, you're not imagining it. Muscle and joint weakness are among the most overlooked yet most dangerous signs of aging, and they can seriously affect your quality of life, mobility, and even independence if you don't act now. What you eat every day plays a direct role in how fast your muscles waste away or your joints break down. These aren't just old age issues. These are issues of nutrition, inflammation, and muscle preservation, especially for older adults in the United States where diets often lack the critical elements needed for musculoskeletal health. The first and most powerful change you can make is increasing your intake of high-quality protein. Not just the type you find in fast food or processed meats, but clean, complete proteins rich in leucine, which directly stimulates muscle protein synthesis. Many people in the United States are under-consuming protein, especially older adults, who often believe they're eating enough when they're not even close. If you're over 60, your body doesn't use protein as efficiently as it did when you were 30. You need more just to maintain what you already have. Think about seniors in nursing homes across the United Kingdom or Canada who start to lose weight rapidly. That's not just fat, that's muscle wasting, known medically as sarcopenia, and it's happening quietly all over the country. The key best foods here are wild-caught salmon, organic turkey, pasture-raised eggs, and Greek yogurt. These provide not just protein, but essential amino acids and other nutrients that help rebuild and preserve lean tissue mass. A 6-ounce portion of salmon gives you over 35 grams of protein and also provides omega-3 fatty acids which directly reduce joint inflammation, especially useful for those dealing with arthritis in their hands, hips, or knees. Speaking of inflammation, the worst thing you can eat is anything highly processed. Foods rich in added sugars, seed oils like soybean or corn oil, and white flour products like packaged snacks or frozen pizza contribute heavily to chronic inflammation. This inflammation is silent at first, but over time, it destroys the cartilage in your joints and impairs muscle repair after physical activity. That's why so many people over 60 in the United States are getting knee replacements or shoulder surgeries when they didn't need to if their food choices had been different 10 years earlier. Think about that next time you walk past a drive-thru or grab a microwavable meal out of convenience. Real food matters. In Australia, more older adults are beginning to adopt anti-inflammatory diets that include turmeric, ginger, extra virgin olive oil, and leafy greens like kale and arugula. These contain compounds that fight oxidative stress and keep your joints functional longer. A great habit is to start every day with a smoothie made of unsweetened Greek yogurt, spinach, chia seeds, and frozen berries. That delivers a hit of antioxidants, protein, and omega-3s all in one meal. Another overlooked but essential category is magnesium-rich foods. Magnesium is crucial for muscle contraction, nerve signaling, and even bone strength. Without enough magnesium, which is a common deficiency in older adults, muscles fatigue faster, cramps occur more often, and joints may feel stiff even when you're not moving much. In Canada and the United States, where soil depletion and processed food consumption are rampant, many older people are unknowingly deficient. The best food sources are pumpkin seeds, spinach, black beans, and avocados. Avocados also deliver healthy monounsaturated fats, which are excellent for reducing joint stiffness and pain. Try adding half an avocado to your lunch daily and notice the difference after just a couple of weeks. Magnesium also plays a direct role in sleep quality, and poor sleep directly interferes with the body's ability to repair muscle tissue or reduce inflammation, setting up a vicious cycle of pain and fatigue that becomes hard to break. Collagen is another key factor, and not just a beauty supplement. Collagen makes up the connective tissue in your joints, tendons, and ligaments, and its natural production begins to decline rapidly after the age of 60. Many people in the United Kingdom are just starting to realize that collagen can actually help repair damaged cartilage and improve mobility. Bone broth, made from simmering grass-fed bones for hours, is an ancient remedy, making a comeback for good reason. It's loaded with collagen, glycine, and gelatin, which support both joint integrity and gut health. Bone broth made at home or from a high-quality brand can be consumed daily or added to soups and stews. Collagen peptides in powdered form can also be stirred into coffee or oatmeal without affecting taste. These supplements are particularly valuable for people with osteoarthritis, where cartilage loss leads to painful bone-on-bone friction that severely limits range of motion. Calcium and vitamin D are often talked about together, and for good reason. While people in the United States are often told to drink milk for strong bones, the issue isn't just calcium intake, it's calcium absorption, and that depends heavily on vitamin D status. Most Americans over 60 are deficient in vitamin D, especially during winter months when sun exposure is limited. This deficiency weakens bones and makes muscles more prone to injury. Fatty fish, fortified dairy, egg yolks, and mushrooms exposed to UV light are among the best food sources. But in many cases, supplementation becomes necessary. A study published in the Journal of the American Geriatric Society showed that older adults with higher vitamin D levels had significantly better muscle function and fewer falls. Joint and muscle pain that never seems to go away may actually be a symptom of undiagnosed vitamin D deficiency, and doctors in both Canada and the United Kingdom are now screening for this much more often during routine checkups. The problem is that many people don't find out they're deficient until after a fracture or serious fall has occurred, when recovery becomes far more difficult. Another issue that's becoming more widely discussed is chronic dehydration among seniors. Your sense of thirst declines as you age, and many adults over 60 walk around in a constant state of low-level dehydration that contributes directly to muscle fatigue, joint stiffness, and even confusion. In the United States, where sugary sodas and coffee dominate beverages, water often becomes an afterthought. But every cell in your muscles needs water to contract and relax efficiently. Every joint needs hydration to keep cartilage supple and prevent grinding pain during movement. A simple rule of thumb is to drink half your body weight in ounces of water per day. If you're 160 pounds, aim for 80 ounces of clean, filtered water. Herbal teas, bone broth, and infused waters with lemon or cucumber are excellent options, especially for those who find plain water boring. Electrolytes, especially potassium and sodium, also play a role in hydration, and foods like bananas, sweet potatoes, and coconut water can help restore balance, especially if you've been on medications that act as diuretics. Omega-3 fatty acids deserve to be emphasized again, not just for joint support, but because they reduce something called C-reactive protein, CRP, a marker of systemic inflammation that rises with age and poor diet. Inflammation is not just a buzzword. It is the foundation of nearly every chronic condition related to aging, from arthritis to heart disease to Alzheimer's. In the United States, where CRP levels tend to be higher due to the standard American diet, ASAD, increasing intake of omega-3s through wild-caught fish, flax seeds, and walnuts can have a measurable impact on blood tests and how your body feels day to day. People who start incorporating sardines or mackerel into their diet 2 to 3 times per week often report reduced joint swelling, better mobility, and more endurance during walks or physical activity. If eating fish is not appealing to you, fish oil supplements can be an effective alternative. But they must be high quality, molecularly distilled, and ideally come from small, cold water fish to avoid mercury contamination. Vitamin C also plays a critical yet underestimated role. While most people associate it with the immune system, vitamin C is essential for collagen formation, and without enough of it, joint tissues can become brittle. Citrus fruits like oranges, lemons, and grapefruit are excellent, but don't overlook kiwi, bell peppers, and strawberries, which have even higher vitamin C content per serving. This vitamin also acts as a powerful antioxidant, protecting muscle cells from damage caused by free radicals, which accumulate with age and chronic stress. In Australia, nutritionists are encouraging older adults to consume colorful fruits and vegetables at every meal to ensure a steady intake of antioxidants that protect both muscle and joint tissue over time. One large bell pepper contains over 150% of the daily recommended intake of vitamin C, and when combined with collagen peptides, it may help your body produce new, healthy joint tissue more efficiently. Most people also overlook the role of resistant starch and fiber in maintaining strong joints and muscles. While this may sound unrelated, the health of your gut microbiome has a direct effect on inflammation, nutrient absorption, and hormone regulation. Foods like green bananas, cooked and cooled potatoes, legumes, and oats provide resistant starch that feeds beneficial gut bacteria. In the United States, fiber intake among adults over 60 is tragically low, averaging about half of what's recommended. This leads to blood sugar instability, increased inflammation, and poor recovery from exercise or injury. Healthy gut bacteria also play a role in producing short-chain fatty acids, which can lower inflammation in the joints and improve energy levels, making daily movement easier and more enjoyable. People who regularly consume lentils, beans, and whole grains like steel-cut oats often report improved digestion, reduced bloating, and more consistent strength during physical therapy or exercise sessions. One of the most underrated contributors to muscle and joint weakness in people over 60 is the drastic decline in hormone levels, especially testosterone and growth hormone, both of which are absolutely essential for maintaining muscle mass and strength. In the United States, there's been a steady increase in hormone deficiencies in aging adults, often going undiagnosed for years. Doctors in Canada and the United Kingdom are slowly starting to recognize how hormonal imbalances impact physical health. But in many cases, the symptoms are misattributed to just getting older. This couldn't be more dangerous. When your testosterone drops, even slightly, your ability to build and retain lean muscle drops sharply. Combine that with a lack of resistance training and a low-protein diet, and the result is accelerated sarcopenia. This is not something to ignore. For women, estrogen also plays a role in joint health, and its loss after menopause contributes significantly to joint stiffness, pain, and even osteoporosis. While hormone replacement therapy isn't for everyone, food plays a critical supporting role in hormonal balance. Foods rich in healthy fats, like extra virgin olive oil, grass-fed butter, walnuts, and fatty fish, support hormone production and reduce inflammation. Zinc-rich foods like pumpkin seeds, beef, and oysters help support testosterone production. Vitamin B6, found in foods like chickpeas, bananas, and poultry, also assists in natural hormone regulation. These aren't fringe ideas. They are backed by clinical evidence and are being implemented by functional medicine doctors across the United States and Australia. Fiber from vegetables is also crucial for detoxification. Your liver is responsible for metabolizing excess estrogen and breaking down waste products that contribute to chronic inflammation. Cruciferous vegetables like broccoli, cauliflower, And Brussels sprouts contain compounds like indole-3-carbinol that assist the liver in this function. People who consume these regularly often report reduced bloating, better joint mobility, and improved energy. It's common for older adults in Canada and the United Kingdom to skip vegetables in favor of simpler meals. But the consequence is that your body gets less of what it needs to regulate inflammation, protect cartilage, and manage blood sugar, another overlooked cause of muscle loss. Blood sugar instability, especially in pre-diabetics and those with type 2 diabetes, is directly tied to accelerated muscle wasting. High insulin levels promote fat storage and inflammation, while also reducing the body's ability to build lean tissue. Stabilizing blood sugar through meals that include protein, fat, and fiber can help reduce these effects. A breakfast of oatmeal with almond butter, chia seeds, and cinnamon can dramatically reduce mid-morning crashes and help preserve muscle tissue by keeping blood sugar levels stable. This is critical for anyone over 60 who wants to maintain strength and reduce their risk of falls and fractures. Creatine monohydrate is another proven supplement that can be used strategically to support muscle strength and recovery. While many people associate creatine with bodybuilders or young athletes, clinical studies have shown that adults over 60 who take creatine alongside resistance training experience significantly greater gains in strength and muscle mass compared to those who don't. This has been particularly true in trials conducted in the United States and Canada, where participants saw improved walking speed, grip strength, and overall mobility. Creatine is found naturally in red meat and fish, but supplementation ensures consistent levels that can be particularly beneficial for those not eating animal products daily. Even a small dose, 3 to 5 grams per day, can improve performance during physical therapy and reduce muscle soreness, which encourages more consistent movement. The psychological benefits are also real. When people begin to feel stronger, they're more likely to stay active, which further prevents joint stiffness and muscle breakdown. This is the kind of positive feedback loop you want to build after 60. Speaking of movement, people need to understand that no food will fix what sedentary behavior is destroying. Joints require movement to circulate synovial fluid, which nourishes the cartilage and keeps it from breaking down. Muscles require load-bearing activity to remain functional. In the United States, where sitting for prolonged periods has become the norm, whether it's watching TV, working from home, or driving, many older adults are developing what's called gluteal amnesia, a condition where the glutes stop firing correctly, leading to lower back pain and reduced stability. The antidote is a combination of proper nutrition and targeted movement. Daily walking, body weight squats, and resistance band exercises can restore neuromuscular function and improve joint integrity. And the foods you eat before and after these movements are critical. Eating a protein-rich snack within 30 minutes after light training can dramatically increase the rate of muscle repair. Greek yogurt with blueberries or a protein shake with unsweetened almond milk and a scoop of collagen powder is ideal. Inflammatory oils continue to be one of the most destructive hidden elements in the modern diet. Oils like soybean, canola, corn, and sunflower are used in almost all processed foods in the United States and Canada, and they're consumed far more than people realize. These oils are high in omega-6 fatty acids, which, when not balanced with the omega-3s, become pro-inflammatory and contribute to both joint degeneration and muscle pain. Inflammation from these oils doesn't cause dramatic pain immediately, but slowly eats away at your connective tissue, leaving you stiff, sore, and prone to injury. Switching to anti-inflammatory oils like extra virgin olive oil, avocado oil, and even grass-fed butter can make a visible difference in just a few weeks. Start checking ingredient labels on salad dressings, baked goods, chips, and even so-called health foods marketed to seniors. You'll often find canola oil hiding behind healthy-sounding words. Australians have been quicker to switch back to natural fats, and studies have shown a significant improvement in arthritis-related joint stiffness when inflammatory oils are removed from the diet. Another hidden factor is the overuse of prescription medications, which, while necessary in some cases, often have muscle and joint-related side effects. Statins, commonly prescribed for cholesterol in the United States, are known to cause muscle pain, fatigue, and even muscle damage in a subset of patients. Similarly, certain blood pressure and diabetes medications can interfere with nutrient absorption or hydration, contributing to cramps and joint stiffness. Doctors rarely explain this in detail, and the older adult is often left confused, thinking they're just getting older. This is where nutrition can either protect or fail you. Eating foods that support mitochondrial health, like wild blueberries, grass-fed liver, sardines, and dark leafy greens, can offset some of the side effects by improving cellular energy production. CoQ10, found in organ meats and available as a supplement, is also critical, especially for those on statins, since statins deplete CoQ10 levels in the body. Without enough CoQ10, your muscles simply won't function properly, no matter how much protein you eat. Eggs are another powerful food that often gets overlooked or feared because of outdated cholesterol concerns. But eggs from pasture-raised hens are nutritional powerhouses, delivering choline, B vitamins, high-quality protein, and healthy fats, all in one package. Choline is critical for nervous system health, and muscle weakness sometimes has a neurological root that isn't being addressed through diet. In the United Kingdom, where eggs have been re-embraced in senior nutrition plans, many older adults are seeing improvements in cognitive performance and physical strength just by increasing their egg intake. A simple breakfast of 2 scrambled eggs with spinach and feta cheese can supply over 12 grams of complete protein, as well as key nutrients for muscle and joint repair. Nuts and seeds, especially almonds, chia seeds, flax seeds, and walnuts, provide a dense source of plant-based nutrients that support anti-inflammatory pathways and hormonal health. They're also high in magnesium, vitamin E, and omega-3s, which are essential for reducing joint pain and improving mobility. However, they must be consumed in moderation and as part of a balanced meal. Many snack on nuts thinking they're healthy, but end up overdoing the quantity without balancing it with fiber or protein, which can spike blood sugar. The best use of seeds like flax or chia is to incorporate them into smoothies or oatmeal, where they gel and slow down digestion, providing longer-lasting energy and steady anti-inflammatory benefits. Lastly, fermented foods play a huge role in gut health and systemic inflammation. Kefir, sauerkraut, kimchi, and miso introduce beneficial bacteria into the gut, which directly modulates the immune system. Since the immune system largely controls inflammation levels, keeping your gut in balance is non-negotiable for anyone struggling with joint pain, arthritis, or chronic fatigue. In Canada and the United States, the diet is overwhelmingly sterile. Too many processed foods, not enough live enzymes or probiotics. Reintroducing fermented foods can dramatically improve digestion, reduce inflammation, and even impact mood and sleep, both of which indirectly affect how your muscles and joints perform. If digestion is impaired, nutrient absorption is reduced, which means even the best foods won't have their full effect. People over 60 need to protect every part of their digestive and musculoskeletal system to truly maintain quality of life. A tablespoon of sauerkraut or a glass of kefir daily is not a trendy health fad. It's a necessity for people wanting to stay active and pain-free past 60.